I'm Dr. George Flynn. You're watching In-Depth TV, and man, have I got a good special guest for you today. Somebody I want you to meet. I want you to know something about him, Dr. Jose Laraya. And Dr. Laraya, thank you very much for being here. Tell us a little bit about yourself. Where do you come from? Tell us about yourself. He's a physician, and we want to know a little bit about you. Where did you grow up, and all of that?
Okay, very good. I'm actually from Canada. I grew up in Toronto and Kingston area in Canada.
And you've lost your accent.
That is correct. I have lost my Canadian accent.
Okay, all right.
I don't say A at the end of the sentence.
A? Okay. All right. And you got to Memphis. How did you get to Memphis from Canada? We're glad you're here, but we just want to know how you got here so we can get more people here like you.
Sure. Well, I got here through a job and medical training in residency program.
Okay, and where were you a resident?
I was a resident at Racine Family Practice in Racine, Wisconsin.
Okay, and you did family practice residency.
That is correct.
And then you came to Memphis to work as a family practitioner.
That is correct. Yes.
And you do family practice. And when I met him, and he's got special interest in certain things that I think you're going to be interested in, and that's why I wanted you to meet somebody that in family practice. What were you drawn to in the residency? What parts of it excited you the most?
Well, what excited me the most, George, is treating adults and hospitals and procedural type medicine.
Okay.
Yeah.
And what does that include?
Well, from the standpoint of hospital, it's treating all medical problems in the hospital: heart failure, pneumonia, congestive heart failure, infections. And then from the standpoint of procedural medicine, I enjoy doing procedures in the office, such as skin biopsies and things like that.
Okay, so it's family practice, but you like doing procedures that are office-based procedures.
That is correct. Yes.
Okay, and do you do anything as far as family medicine? Do you do older adults, younger adults, or pediatrics, or where do you draw the line, or do you draw the line?
Right. At the current practice I'm in, I'm seeing anyone above 18.
So it's 18 or older.
That is correct. Yeah.
Okay, and what in this area? What do people usually come in for?
Well, a lot of people come in for well adult checks, or they come in for a variety of problems that are unique to family and general medicine. Examples would be skin problems, muscle aches and pains, high blood pressure, or chronic disease like diabetes or high cholesterol.
And you can manage all of those?
Oh, yes. I'm well trained in all those areas.
Okay. So you talk about muscle aches and pains. I mean, everybody's got those.
That's right.
And what do you go through to be able to figure out what's going on with them?
Well, George, I usually go through a complete assessment, including a history where I talk to the patient at length, find out what's going on with them, do a physical exam to assess the body part that they're concerned about. And then I come up with a diagnosis or a working theory of what's going on, and then I recommend different treatment modalities to help them with their aches and pains. Okay,
it's either physical therapy or I don't know, massage therapy, or do you recommend any of those, or do you have anybody in the office doing any of that?
Yes, indeed, I do recommend physical therapy for people who need it, and that is the gold standard for a multitude of different muscle aches and pains.
So it's not just take a pill?
That's correct, yeah.
Okay.
Yeah.
And you're very interested, and I've saved this for a little bit, very interested in wellness.
That is correct, yes.
And some people out there, and some people I know, and some people you know too, say, I don't need to go to the doctor, I feel okay. What do you recommend people come in for a wellness check, and how often do you recommend that? And what is your training, and what are your recommendations on that?
I recommend coming in to start with for a full assessment, like an introductory wellness check. And then from there...
And what does that involve? Does that involve a lengthy history and physical?
Well, it does involve talking to you for quite a bit of time, getting your medical history.
And that's what I see is decreasing in medicine, is the interaction time that you have. About how long does an interview like that last? Because I think patients want more and more of it.
Yes, yes. I agree that the interaction has lapsed over time. But I will spend, in total, a good 30 to 40 minutes doing an assessment like this.
So you say somebody would get to speak with you 30 or 40 minutes. You get to know them, know something about their entire life.
That's exactly right. Yes.
Okay, and then what happens?
Well, after I take that general history from the patient, I will do a physical examination, and then I will order any lab tests or investigations like x-rays that I feel are needed.
Right.
And then I will go over a detailed checklist of the kind of wellness things that we should look at based on their age and their risk profile.
Okay, so the wellness things include, I guess, cholesterol in the blood test, and what are the blood PSA for men, and what else? What else would you have?
Diabetes check, for example.
So A1C,
and glucose.
Glucose, and then what about just regular blood tests, regular CBC or blood count?
Exactly, a blood count, chemistry panel, checking all the different things that I'm concerned about.
Okay.
For example, if the person has high blood pressure, we will check kidney function and electrolytes, things like that. If they have diabetes, we'll check protein in the urine, things like that.
And where would you get to something like I just feel tired? Would you check thyroid or any of those?
Yeah, people who are tired often have a thyroid or anemia underlying, and sometimes they do have some sadness or some depression that they're concerned about, or nervousness, and something has happened in their life that they like to talk about.
Now that's really important.
Yes.
Do you take into account the psychological impact of daily and life stresses? So you do look at that?
Yes, most definitely. Most definitely.
Okay.
I taught medical students in third year for quite a while in my previous practice, and I taught them that every patient has some kind of a background in their some kind of emotional concerns that come to the fore with their physical concerns.
Okay, so emotions do affect the physical body. They affect. You can prove that by scaring someone. Their heart rate will go up and their eyes will get wide and they'll have an adrenaline release.
That's correct.
So you do take that into account. So we have the history, physical, lab work, and then you assess. Then once you get all of that, do they come back in and see you again for treatment options?
Yes, it depends. If I order things, then I will have them come back to discuss with me the results.
So you don't just call them up and say, hey, they come back in and have a full discussion with you.
I like to discuss things face-to-face with people because I find the interaction is a lot better. If the person would rather have a phone call, we could go that way as well. I like face-to-face interactions because there's room for a dialogue and there's room for a physical exam if I need to pursue that or do any further investigations that need to be done. But I do like to send people out also for mammograms and things like that.
Right.
If they need a pap smear, we could arrange for that. Colonoscopy for colon cancer screening. So there's a variety of things that I'd like people to do, and I like to see them back to talk about what happened.
Okay, and so you give them the results not just over the phone or by a letter. You like to have them come back in and talk to them actually.
Yes. That's my preference, but I will, if the patient wants to, I will call them. Yes.
Okay, so I think most of them would rather talk to you.
Yes, I agree. I agree that most people would rather have a face-to-face conversation.
Now, where have you opened your office, and where did you decide? How did you decide to open it in a certain area? Where is your office?
Well, my office now is on Stage Center Drive. It's on the corner of Stage and Bartlett Boulevard.
Okay.
And that's in Bartlett.
Right.
And that's an established practice called Verzosa Ungab Internal Medicine.
Okay.
Sam Verzosa and Ramon Ungab.
Okay, and you're in that practice with them, and it's a fairly easy location to find. What about parking? Everybody wants to know about parking. How is parking?
Parking is very, very good. There's plenty of parking. Okay. And there's always parking available. Yes.
So people can come into your office. There's no problem with parking. That's or correct. They just come in and they come in and see you. All right, I'll ask the tough question.
All right.
How long do they have to wait?
Well, the waiting times right now, as I'm getting started, is quite low, but I would say it's probably on the order of maybe 15 to 25 minutes right now.
Okay, so they come in, they fill out paperwork, and so the waiting time is not,
Right.
is minimal.
Yeah, it would depend also if you're a new patient or established patient.
Okay.
The newer patients would wait a bit longer to get everything.
To get everything filled out. They're not waiting, they're actually doing things to expedite their visit with you.
That's right.
Okay, so they have a visit. What are the other things that people say? Well, what about insurance?
Well, we do accept,
Everybody wants to know about insurance these days. What about?
yes, we do accept a wide variety of insurances. That's correct. Private insurance and commercial insurance and Medicare are the main insurances that we take right now.
Okay.
We do have a program for self-pay patients as well.
Okay. So you'll take patients and you'll help them out.
Yes.
No matter what.
Yeah, that is correct.
All right. And your practice is going. You're enjoying it. What do you get to do when you're not working? Now it sounds like you're working a lot, but what do you get to do?
Yes, indeed. Well, I enjoy exercising. I like to ride my bicycle and do yoga, and occasionally I go boating or fishing.
Bicycling, are you talking about real bicycling, or are you talking about, like me, cruising around, or are you talking about racing?
Mainly cruising around.
That's me, cruising around. And yoga I found to be very, very interesting. It keeps you more flexible and you're able to calm down a little bit.
Yes, yes. It's very emotionally relaxing and physically relaxing as well, with the stretching, strengthening, and balance that you can get from it.
Right. And we've had some, proponents of yoga on, and they say it really helps calm down. And some people say it helps with blood pressure, but who knows? I think it helps you just in general to be able to take that time for yourself. And there's another question. How many days a week are you open?
Well, the office is open from Monday through Friday.
Okay.
I do not see patients in the office on Wednesday.
Okay.
So I'm, Monday, Tuesday, Thursday, and Friday, and we're not open on the weekends.
Right.
But I do see patients in the hospital every day if they're.
So if they're your
hospitalized.
patients and they're in the hospital, somebody's seeing them, probably you, every day.
That is right. Yeah.
Okay. Which hospital do you usually go to?
Well, right now I'm going principally to St. Francis Bartlett.
Okay.
But I will go on occasion to Methodist North, and our group covers both hospitals.
Okay, so you're going to two different hospitals, so the patients, if they're out of network in one thing, they can go to another place.
Yeah.
You have really done well, sounds like.
Well, thank you.
Yeah, it sounds like you've covered the bases and anxious to see people that you can help.
Yes, yes.
And if you get somebody that you just really don't feel like you can help, what do you do? Do you refer them out, or?
Yes. Obviously I can't do everything. So,
Right.
If I need a specialist.
So if they need heart surgery, you'll send them to someone. Or?
That's right. That's right. I do want to add that I occasionally will go to Methodist University Hospital, which I enjoy a great deal. I like that hospital as well. If a patient is beyond the scope of the hospital, the community hospital, St. Francis Bartlett and Methodist North, I will take the patient myself to Methodist University and see them there.
Okay.
Because I like the continuity of following them in the teaching hospital.
Okay, so you're able to see them, and then when they come back to see you, you will have seen them through their hospital stay.
That's right.
And be able to know what happened in there and just have a nice continuity of care.
Right. Yeah. That continuity is very important to me. And I think it's almost a dying breed, the doctors who go back and forth between the hospital and the clinic. But I myself enjoy doing it because I get that continuity of seeing people in both settings.
Right, and you get to know people.
That's right.
And know their families.
Yeah.
And they get to know you and your philosophy and how you operate. Your philosophy, though, is centered on wellness.
It is centered on wellness. That's correct.
And when something is not right, you can find it out faster.
That's right. That's right.
Thank you very much for being here with us, and we're going to put your name and contact information at the bottom of the screen. I'm Dr. George Flynn. Thank you for watching, and we'll see you next time.